Hi, so this is Dr. Gutman. I'm going to be hosting our CapYear podcast today, and I'm with Alli Pocsik, who is a graduate of University of Michigan, who's currently working as a medical assistant during her gap year. Hi, Alli. How are you doing?
Hi, I'm good. How are you? Thanks for having me.
I'm so glad you agreed to do this. So we're just going to talk for a few minutes about what your experience has been being a medical assistant. So first and foremost, how did you decide what you were going to do with your gap year?
So, when I was thinking about what I wanted to do with my gap year, the main thing that I knew I wanted was to get patient interaction and experience actually treating patients and being around patients. So, that's kind of where my main motivation came from for being a medical assistant. I thought about scribing also, but the thing that I really liked about medical assisting was that it was a super active process and you got to really be involved in the care of patients and learn how to do vitals. And at my practice, we get to draw blood and we do EKGs. So I think just having that active role in patient care, that was kind of the main thing that drew me to medical assisting. And so that was kind of the only type of job that I ended up applying to. I decided pretty early on that would be the right thing for me to do in my gap year.
Did you have any clinical experience going into the job, or how did you prepare yourself to do that?
I had shadowing and I had done kind of like an internship over the summer, my sophomore year with an orthopedic surgeon. But mainly what I had done was passive stuff. It was shadowing and kind of just watching. So it was definitely new for me. But I think just being really open to the idea and willing to learn and kind of ready to have a lot of questions and not be perfect at first, which I know can be tough, especially for pre-meds. But yeah, I think just going into it ready to learn and knowing that you're not going to be graded at the first time that you try to do things. That was kind of how I prepared going in.
And now, did you end up doing a certification course? And was that helpful, do you feel like?
So I did a certification course because the job that I ended up in did require that you had a certification or you had, I think, a year or two of experience, which I obviously didn't have. So I did it. Honestly, I don't think you need to do a certification just because also mine was fully virtual. So it's not like I did anything in a classroom or on real people. And it was asynchronous. So I was just doing modules on my own and a lot of it can be taught on the job and a lot of you don't do all the things that you're taught in the class and you do things that aren't taught in the class. It just really depends on the job. So I think it's really not necessary to get a certification and the only reason that I did it was because I needed to.
And so tell me about the current job you're in. So what's the practice like? What do you do on a day-to-day basis?
So the practice that I work at is multidisciplinary. So basically there's a lot of different specialties, which is definitely overwhelming because we work with all the doctors. We rotate each day who we work with. But it's been great because you kind of get to see how the different doctors work and how different specialties work and kind of what type of patients are presenting to the different doctors. So for me, day to day is rooming patients. So bringing them in, doing their vitals, blood pressure, height, weight, doing history, etc. And then we'll do labs. So we'll draw blood and we'll do EKGs if they need them. So it's pretty involved. And that's something that I liked about it a lot because I knew that I would get to spend a lot of time with the patients. And when I'm in there with the patient, like the doctor isn't with me. So, I'm by myself with the patient. I feel like I've really gotten to grow my communication skills a lot. I'm not always the most outgoing person with strangers. So I feel like that has been something that has been really great for me because it's just me and the patient. So I kind of have to, talk to them and make them feel comfortable. And I'm the first person that they're interacting with in the office. So I feel like it's kind of my responsibility to start them off on a good note.
What do you think was the hardest part of the learning curve? So I assume like you got a good degree of on the job training. Like, was there some sort of training period before you were able to kind of do things on your own, or how did that work?
Yeah, so when I first started, I started by shadowing the senior medical assistant, so I would just kind of go with her and watch her, and then it transitioned into her being in the room with me, but I would do the vitals and stuff, and then slowly it progressed to me being on my own. I think probably the hardest thing to learn was the phlebotomy, just because it's very different from anything I had done before. All the stuff like all the technical stuff, the Epic and whatever system that, you might use, it doesn't take that long to pick up, kind of it's repetitive. So I think like the physical clinical skills were probably the hardest, and my coworkers were kind enough to let me draw their blood as practice. But I think the main thing that has helped me get more comfortable with it is just practice. Like the more I do, the more comfortable I get. And now that I've been there for over a year, like I feel like I could do with my eyes closed. But that was definitely the hardest part, I think, just because if you're coming in with no experience, like it's just different.
And how do you think, I mean, do you think your perspective has changed significantly since before? Like if you had applied straight out of school versus doing this gap year where you got this hands-on clinical experience, did that kind of change your mind about anything or make you feel more prepared or?
Yeah, I definitely think it made me feel more prepared. I'm so glad that I did not go straight through. I actually don't think I would have survived. I'm doing 2 gap years, which I think is perfect because it's just a lot of time to learn and like actually being in a clinical setting and being involved in it and not just shadowing or just, standing there and watching is like that's what being a doctor is like being with the patients, interacting with the patients. So I think it's been the best thing that I could have done. And everyone at my practice is so supportive, and my coworkers and all the doctors are so excited when I tell them that I'm going into medicine. And I feel like it makes me feel so happy because everyone is just so supportive, and all the patients too. Like a lot of them will ask like, "Oh, are you going to go back to school?" And I tell them that I'm applying to medical school, and they're like, "Oh, good for you." Like it's just such a good feeling too. So I think that it has been such a great thing, and I would recommend a gap year or 2 or 3 to
Have you had
anyone.
a chance to tell them you've been accepted to medical school?
I told my coworkers today, they were so happy.
Well, hopefully they'll do
So,
something nice for you.
yeah.
Any like last minute, so in medicine, when we do like M&M, so morbidity and mortality, or like when we teach, we always talk about what's called clinical pearls. So like those kind of kernels of truth that are, we pass along, to future generations about like clinical practice. Any pearls you would share with people becoming medical assistants, like tips and pointers, like for their job or for getting ready for the job?
I think just go in with an open mind, be ready to learn a lot, know that you're probably gonna fail at the beginning. There were times where I would go in to draw blood, just completely miss the vein, and I was so embarrassed, but it happens to everyone, and everyone was in your shoes at some point, which is hard to remember when, there's people in my practice who have been at medical assistants for like 20, 30 years. So it's hard not to compare yourself to them, but just try to focus on yourself, and you really will get more comfortable over time. So I think just, yeah, going into it knowing that you're not going to be perfect at the beginning and there's a lot of room to grow, and just to enjoy the experience and learn as much as you can. Also ask a lot of questions. I asked so many questions, and I used to think that it wasn't good to ask questions because it meant that you weren't confident, but I feel like it shows that you're more confident because you're more willing to learn and you want to do the best that you can. So anytime I was unsure about anything, or even if I was pretty sure, but I was like, "Oh, let me just double check," I would always ask. And now I feel like I'm just so confident with all the skills that I do. Now I'm training the new medical assistant, which is like a whole tables turned kind of situation, but it's come full circle. So I think just being really really open and willing to learn and lean on the people around you, because chances are they have a lot more experience than you. So they're only there to help you.
So, I mean, like so much growth, so many competencies, but like you said, kind of ready to move on probably and kind of reach that next level. So, congratulations
Yeah.
on your med school acceptance.
Thank
And thank
you.
you for sharing that with me today.
Yeah. Thanks for having me.